Hello all, welcome to my channel.
Today we are going to learn about blood collection procedure, methods of blood collection and order of blood draw. Firstly, we are going to learn about collection of blood samples. Collection of the blood samples and other biological specimens are crucial to the understanding, prevention and treatment of the diseases. The collection of blood samples depends on the tests to be done. So we'll collect the samples according to the tests. Whatever the samples needed, it's collected in order. Methods of blood sample collections. There are three popular methods of blood collection. First one is arterial sampling, second one is venipuncture sampling, and third one is finger prick or capillary sampling. So firstly we are going to learn about arterial sampling. An arterial blood sample is collected from an artery, primarily to determine arterial blood gases. Arterial blood samples should only be performed by health workers. The sample can be obtained either through a catheter placed in an artery or by using a needle and syringe to puncture an artery. These syringes are pre-heparinized and handled to minimize air exposure that will alter the blood gas values. So we'll see the sites of arterial blood collection. The first choice is the radial artery, which is located on the thumb side of the wrist. Alternative sites for access are brachial or femoral arteries. So you can see in the picture. Okay, now we will see procedure to collect the arterial blood samples. The procedure is done as follows. The area is cleaned with antiseptics. A needle is inserted. Blood flow into a special collecting syringe. The needle is removed after enough blood is collected. Pressure is applied to the puncture site for 5 to 10 minutes to stop the bleeding. Here, the syringe is pre-heparinized. Next, we are going to learn about venipuncture sampling. Venipuncture is the collection of blood from a vein. It is most often done for laboratory testing. Blood is drawn from a vein by venipuncture, usually from the inside of the elbow or the back of the hand. A needle is inserted into the vein and the blood is collected in an airtight vial or a syringe. Okay, next we are going to see the sites of venous blood collection. Venous blood is the specimen of choice for most routine laboratory tests. The blood is obtained by direct puncture to a vein. The most common site for venipuncture is the antecubital fossa located in the anterior elbow at the fold. This area houses three veins, the cephalic, median, cubital and basilic veins. You can see the veins marked in the picture. Next, we are going to learn about the collection of venous blood. The procedure for collection of venous blood is assemble the equipments priorly, identify and prepare the patient, select the site, perform hand hygiene and put on gloves, disinfectant the entry site, take blood, fill the laboratory sample tubes, draw samples in the correct order. Next, we are going to learn about finger prick sampling. Finger stick or finger prick sampling involves taking a minimal amount of blood from the patient, usually from the fingertip. Finger stick sampling is over quickly and requires very little preparation, which helps to reduce stress and anxiety in patients, particularly in children and nervous adults. Next, we are going to learn about capillary blood collection. A capillary sample is a blood sample collected by pricking the skin. Capillaries are tiny blood vessels near the surface of the skin. Capillary blood is obtained by pricking a finger in adults and a heel in infants and small children. Next, we are going to learn about order of blood collection or order of draw. To avoid cross-contamination, blood must be drawn and collected in tubes in a specific order. This is known as the order of draw. The correct order of draw is firstly blood culture tubes or vials, next coagulation tubes, blue top tubes, serum tubes without clot activator or gel, red top tubes, serum tubes with clot activator or gel, gold or tiger top tubes, heparin tubes, green top tubes, EDTA tubes, lavender top, oxalate or fluoride tubes, grey top, and ESR tubes, black top tubes. This order of draw is based on the anticoagulant present in the tubes or vials. This is the order for blood sample collection. Thanks for watching my video. Please do subscribe and support me, and don't forget to hit the bell icon so that you will get the notification for my new uploaded videos.